Hi, I am delighted to present our project Robust Recursive Partitioning for Heterogeneous Treatment Effects with Uncertainty Quantification. We develop a heterogeneous treatment effect analysis method to find subgroups that consist of subjects who have similar covariates and treatment responses. The identification of subgroups is important because it improves the interpretation of treatment effects, which makes it possible to develop more effective treatments and to improve the design of further experiments in very wide areas from clinical trials to public policy. In the previous HTE analysis methods, subgroups are identified by maximizing the heterogeneity across subgroups, while ignoring the homogeneity within subgroups. They rely on a specific individualized treatment effect estimator, decision tree. Suppose the true treatment effect is generated by a Gaussian distribution with 0 mean and 0.1 standard deviation. Clearly, there are no subgroups. As shown in the figure, the previous methods may find some subgroups if there are groups that have different sample means due to sampling error. To improve the robustness of subgroup analysis methods, we try to quantify uncertainty in the discovery process using confidence intervals of the ITE. We start by constructing an ITE estimator for the entire covariate space. Here we can use any kind of ITE estimator. Then we measure the homogeneity within a subgroup by the concentration of the ITE within the subgroup. Specifically, we obtain the confidence intervals of the ITE estimator by using a conformal prediction method. The confidence intervals constructed by conformal prediction satisfy the frequentist coverage guarantee in finite samples. Now we develop a confident criterion for partitioning the covariate space into subgroups recursively. In the criterion, we minimize the absolute deviation of the ITE confidence interval, Sx. We also minimize the expected confidence interval width Wx, because a narrower confidence interval can also help to reduce the deviation. As shown in the figure, the criterion splits the covariate space X into two subgroups. The criterion improves both homogeneity within subgroups and heterogeneity across subgroups. After splitting, we reconstruct the confidence intervals using the samples within each subgroup. Then the confidence intervals satisfy the coverage guarantee within each subgroup. The theoretical guarantee of the confidence intervals in our method can help to avoid false discoveries of subgroups. If the confidence intervals exhibit large overlap across the constructed subgroups, the constructed subgroups are not well identified. Conversely, if the confidence intervals have little or no overlap across subgroups, the subgroups are well identified. Finally, we evaluate our R2P method by comparing its performance with state-of-the-art heterogeneous treatment effect estimation methods. For this, we mainly use the variances across and within subgroups to evaluate the heterogeneity and homogeneity respectively. From the table, we can see that our method R2P achieves the best performance in all the performance metrics while discovering subgroups with minimum overlap to avoid false discoveries as shown in the figure. Thank you for watching.